To South Africa, where an organization is working actively to help reduce the infection rate of HIV/AIDS among the youth. The group LoveLife focuses on youth empowerment and well-being and is South Africa's largest national HIV prevention initiative for young people. Joining us live via Skype from Midrand, South Africa for more insight is Andile Dube. She's the director for youth programs with LoveLife. Mrs. Dube, welcome to the program.
Thank you.
Tell us how HIV/AIDS is affecting the youth in South Africa, and who is most at risk among the young men and the young women?
The HIV in South Africa is one of the biggest challenges for us and the youth. Young women are mostly affected. I think that there's a number of reasons that happen. Some of the reasons could be individual factors, but some of these individuals are really the cultural aspect and the structural aspect of our landscape. Young women remain the most affected, and we actually experience the high or peak at age 15, and that's also aligned to our age of sex debut. So the average, when young people begin to have sex, they tend to actually have unprotected sex, and they have unprotected sex with a relatively older set of men.
So tell us, what are some of the steps that your organization is taking to target specifically young women with regards to this issue?
For us, I think we've tried to actually not necessarily just single out young women, but most of our programming will have a balance for young men and young women. But we currently have a program that talks to the capacitation of young women, and it's around the demand creation for condom use, but it also empowers young women to talk to their needs and what they actually think is best for them. So we have a lot of programs. Some of the programs deal with your self-esteem, the issue around the identity, the around a sense of belonging. But we try to actually turn a situation of less hope into hope. We try to actually say to young women and men that unless you have a very clear perception of where you're going, you are unlikely to actually get there. So you'd rather have a better perception of where you're going and change your circumstances, and we do all of that through you. So the implementation of our program is also by young women and men who are called groundbreakers and pinches.
Okay, we don't have much time left, but tell us one of the most common misconceptions that you come across when you're dealing with the youth with regards to HIV/AIDS.
I think the biggest one is youth are useless and youth are there to be handed off and to be handed as charity. Young people actually drive those programs. Young people actually, if you give them the platform and you give them the resources and you give them the hearing and you give them an option to actually be meaningfully participating, young women actually drive this, men and women drive these programs. For us, I think we wouldn't be able to do what we do without the peer-to-peer kind of programming and the youth leadership program for us. I think the biggest perception is young women and young men are there to us.
Mrs. Dube, thank you so much for your time. That's all the time we have for today. And that was Andile Dube, the Director for Youth Programs with LoveLife. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com. Timiake Vincent, back to you.
Thanks, Linord. Thanks a lot. Thanks a lot, Linord. Be sure to watch Linord Moudou's informative Africa Health Network reports every Tuesday and Thursday right here on In Focus.